So, good morning, everybody. I can't see you on the screen. That's a little bit disconcerting for me, but I know that you're out there. I can see things that are happening in the chat. Um, my name is Andy Appleyard. I'm the Director of Adult Social Care at Derby City Council. I'm going to chair this for you today, this event for you today. The reason for that is the depth and breadth of work that we're doing in Derby City Council in terms of artificial intelligence. We have got some absolutely fantastic speakers. So today we'll run you through what's happening across a whole range of different areas. I've got some housekeeping rules for you as we start. So this webinar is being recorded. You will have all come in. You will be on mute. As I say, you can't be seen. Slightly interesting that I can't see faces, but I can see activity is already happening in the chat. So that's fantastic. If you all want to introduce yourselves and connect with colleagues, that seems absolutely fantastic. But if you do have a specific question that you want any of our panelists to answer, if we can ask you to use that Q&A function. So you should see that a little bit, a couple of icons down from where the chat icon is. So as I say, really keen to hear your views as we go through this, really keen to make sure that we're capturing your thoughts and we can answer the questions that you want us to answer as we go through this. So as everybody will know, AI is increasingly being used and explored across adult social care to improve efficiency, to support our workforce, to enhance decision making and to improve outcomes for people receiving care and support. One of the things that I wanted to say is here in Derby, we are utilising AI across our adult social care services. And one of the things that we're trying to implement at the moment is the principles of the Oxford Project. So some of you will have heard about the Oxford Project, some of you won't. Really useful information for you to go and weigh and look at. What the Oxford Project are doing is they have created a number of I and we statements, and they are through the eyes or through the role of either social care workers or social care organisations. They've got I and we statements that would sit naturally with care providers, with technology providers and developers, and also people who use services. And I think they're really good guiding principles, as I say, that we're trying to look and embed as we explore the AI opportunities here in Derby City Council. I've recently presented at the National Care Association conference. There was a big focus on artificial intelligence there. And I thought a panelist posed an absolutely fantastic question that I think you should maybe hold in your minds as we go through this process. That question was, what is the specific question are you trying to answer with artificial intelligence? And is AI the right answer to that specific question? I try and make that a little bit easier to understand in people's day-to-day worlds here in Derby. So one of the questions that I ask people is, do you get in your car to drive to the local shops? Your car will get you to the local shops. It's often a quicker way of you getting to the local shops. But I would hope the majority of us tend to still go to the local shops by walking there. And the question that I'm really trying to pose is, just because AI can do something, does that mean that AI should be doing something for you in your local authority? Certainly for us, it's about helping our social workers to be more efficient in their roles so they can spend more time working with people, coming to work, doing the things that they want to be doing in their day-to-day working lives, rather than does AI have the functionality to be able to do this? So I think as we go through this and you explore using AI in your organization, it's probably what is the functionality and what is the support that AI can give to us, rather than is this something that AI can actually do? So how do you get the benefits right, I think is really key. But as we go through these sessions, hopefully you'll be able to hold that sort of question in your mind and see where you'll be able to use AI in your organizations if you aren't doing so already. Okay, so the first person that I am going to hand over to today is Eleanor from the Digital Care Hub. Eleanor is going to walk you through understanding AI and what is and what AI isn't. Eleanor, can I hand over to you?
Hi, Andy. Yes. Hello, everybody. I've just sneaked away from another conference. I'm hoping they don't all bombard in. If they do, then Fiona will take over for me. But yeah, welcome and thanks for having us and East Midlands ADASS. It's great to be here. Yeah, Fiona, do you want to go on the next one? So just a quick run through about Digital Care Hub. Who are we? So we're run by social care providers on behalf of social care providers. So we're a community interest company and we represent a diverse group of different organisations in the adult social care sector. And we work with a huge partnership stakeholder group and we're funded by Department of Health and Social Care. But ADASS is one of our kind of key stakeholders that we work with. So this is just a short video, but I thought it's a couple of minutes. It's a really good way of explaining what AI is and setting the scene. I can't hear that. Can anyone else?
Silent for me too.
Okay. Fiona,
Good
I don't know if
start.
you need.
Always love it when it's a tech webinar and the tech goes wrong.
Yeah.
We did even just check this as well, so I'm not entirely sure what I've done differently.
We did just check this. It was all
I
working.
promise you, we're
Perfectly
not just
working.
winging it.
It was.
Okay, Sam, any suggestions?
I've just
No,
done multiple participants can share simultaneously. Try now.
Artificial intelligence, or AI for short.
that's got it.
Is that worked?
Yeah.
You might.
Oh, good. Okay, I'll go back to the start. Sorry, everyone. Little false.
I think. Great.
No, we've lost it again now, unfortunately.
Yeah, it's silent again.
Oh, crikes. That's so bizarre. Why does it keep going?
Try one more. If not, we'll.
Okay, we'll try one more. If not, we'll
No.
sorry. We'll try once more. If it works, great. If not, I bet it's because my microphone's on. I think it's picking up the residual sound, not actually sharing the sound from my screen. Is the quality good enough if I leave my microphone on?
Yeah.
Okay, we'll try that then.
Artificial intelligence, or AI for short, may feel like a mystery, but you might already be using it in your life right now. Learning how to get the most from AI can help make your life a little easier and even save you time. AI can work with lots of information and do complicated things super quickly. Things like helping you choose when there are too many options. Imagine picking something to eat from a food menu. The menu is the same for everyone every time. You look through everything on the menu, thinking about what sort of food you'd like to eat. AI is a bit like having a helpful chef step in. You tell them what food you like, and they'll suggest a few dishes for you. And like a chef, AI can adapt and learn. The more feedback you give it, the better the suggestions next time. Some online shops use AI like this. They learn about you based on what you've looked at or bought, then suggest other products you might like. TV services like BBC iPlayer use AI to recommend things to watch. The more you tell them which shows you like, the better it gets at choosing programs for you. And then there are social media platforms like Facebook. They use AI to suggest people you may know from millions of users, or recommend articles based on your interests and habits. So what you see will be different from what everyone else sees, as well as helping you find things you like. Some websites use AI to answer your questions. You type a question into a box, and AI will try to give you an answer. These are called chatbots. They can save you time and effort when searching for help. Some websites even give their chatbot a name to make it seem like you're talking to a human. There are also AI tools that can help you write things, like a letter or a job application. AI is a great way to get started, but remember, just like humans, AI can make mistakes. Always check that any important details are correct before you use them. And if you're not sure, ask someone to help. Whether you need help making choices or starting a task, AI can save you time and make things easier, letting you get on with more of the things you enjoy. Now you know a little more about artificial intelligence. If you feel more confident about using it, give this video a thumbs up.
Brilliant, thank you. Yeah, that's from the Good Things Foundation. If you want to share it, it's on YouTube. It's a really good little short. definition. So then I thought I'd kind of, then set the scene, define how we see it in words, context. So artificial intelligence, as cited by the Cybersecurity Centre, can be described as any computer system that can perform tasks usually required by human intelligence. So this can include verbal, visual, perceptive text, anything like speech generated or different languages. Next one, please. So I thought I'd kind of look at how this applies to adult social care. So we've kind of defined it, we've seen what it means to us, but there's different ways that it can affect our sector. So you've got chatbots on the left-hand side here. So this is one of the most common uses. We've probably all used them in our personal life as well. They can respond to routine inquiries, so they can like do simple things about opening hours, visiting times. They can also support staff on quick internal questions. They're basically there to support and not replace. And I'll talk this kind of as a common theme throughout. We're not replacing that personal touch and that human care worker. Efficiency. So again, this is a bit more of a step up. You can draft policies, you can search policies, you can kind of create responses and look at kind of, different ways of bit more involved. And activity. So this is kind of a nice, fun way of seeing, helping make things a bit more interesting for the kind of resident or the person that you're visiting in the home. It can tell stories, it can reduce loneliness, and it can help kind of isolation. So probably ones that we've all used in our personal life as well on the activity side for like fun questions and games. Next slide, please. But what are the risks? So this all carries risk. I think this is coming out more and more now. I'm definitely talking to my friends and family about it when we're like, oh, let's ask ChatGPT. So there's some really key things that you need to think about. Whatever you put in, and I'm sure some will go into this, whatever you put into ChatGPT and the like will always be there forever. So we can't be putting in personal information that will stay there forever. I know at the weekend we were like messing around with family and they were putting the pictures of them and making it AI, and I was thinking, well, this is going to be out there forever. But to go into it, so it's poor data. So basically all systems are only as good as the data that's inputted. So what happens is it retains this information and it will regurgitate it the more people put it in. So if people are putting in the wrong data, it just will use the wrong data. So poor quality and can be inaccurate. There's a bias. So we can be built into AI if training data does not reflect the diversity of the people inputting it. Again, this can lead to unfair outcomes and inequalities. Hallucination. So again, generative AI can sometimes produce hallucination. So it can sound confident. It can sound like, it talks to you and says, oh, well done. Thanks for asking that. That's a great idea. Like we've all been there. So like it can lead you that it's the right thing that it's saying and the right thing that it's answering. And it can disempower staff if you're not careful, because they'll make them feel like they are redundant and not needed. And again, I'll probably mention this later on, I'm sure others will, but it's about bringing the staff along with the journey and being kind of open with them. And GDPR, so it's making sure that, whatever you're putting in, you can put in there. It can go out into the public domain. Next one, please. So misconceptions on AI. So as I've said, it's not here to replace humans. I think this has now become accepted that we don't want to replace humans. I think there was some story about in a Japan care home, they replaced them completely with robots. And I can't remember the final outcome, but it wasn't like a happy one. It couldn't do all the jobs. It couldn't, have that one-on-one care with the residents. So it's not about taking and kind of helping them. Don't overestimate its accuracy. We've mentioned this. Don't think that whatever it says is completely right. It is whatever is inputted into it. Everything you put into ChatGPT, for example, is never forgotten, which I've mentioned. So don't put personal details in, because it will never be forgotten and that could be used against you. Digital divide and infrastructure limits. Are we ready? Are the rural communities ready? Are the, dom care where you go out to that kind of small town and village, or that independent house on the edge of the kind of village, is that getting the internet? You know, Fiona and I were talking earlier about kind of digital exclusion, and you know that won't those people and those residents that aren't able to access the internet and the ChatGPT, are they going to be disadvantaged if you start offering kind of, you know, everything on ChatGPT? So this is linking into now the Oxford project, which I think Andy touched upon. So this is a partnership we're doing with Oxford University and a consulting organisation called Casson Consulting. And with the 3 organisations have got together to look at the responsible and the ethical use of AI, as the use of AI systems in the care or related to care of people supports and does not undermine, harm, or unfairly breach fundamental values of care. So including human rights, independence, choice and control, dignity, equality and well-being. So it's a lot to think about, but that's kind of setting the scene about how to ethically use it, I guess. Next one, please. So as I've said, the Oxford Statement of Responsible Use, the link's there. I know the slide decks will go out to everyone who's registered, and you can have, I've just seen the speaker keeps breaking up. Okay, sorry, I'll get a bit closer. My internet was a bit funny. Let me bring my hotspot. Can you hear me?
We can.
Yeah, I'm going to turn off my, oh, did Fiona might have turned off my video to help me.
I've
Okay,
just
great.
done it. Yeah, sorry.
Yeah, well done, thanks. Okay, so basically, yeah, it's the Institute of Ethics and AI. Take a look at it. It's all about kind of the I and we, as Andy said. They first started in February 2024. They had another conference in last year, and they've got one coming up next month. And it's all around how different stakeholders, from those with lived experience, government, you know, those that provide care, those that receive care, key stakeholders like TLAP and Digital Care Hub. And it's all about how we as an organisation and a group can enforce policy upon the sector to create ethical use of AI and get the government to listen, basically. Next one, please. So this is just an example of one element of the co-produced guidance, and you can have a look at all of the different elements. But the key areas they asked to highlight were kind of those that draw on care, people who work in care, and as providers of care, but also the tech are key kind of workers, key need to be involved and come along the journey. It's all about making sure the supply chain is working with us as well in this instance. Next one, please. So what can the sector do? So use co-produced guidelines and ethical principles. So again, looking on the Oxford statement, looking at those that kind of the I and we, if we all had the same philosophy and the same guidelines, then we will work to the same high standards. Ensure human-centered co-production and collaboration. So build forces together, include services from the start, bring your team along for the journey, and make sure that you're not kind of forgetting them. Have a digital trailblazer who brings on their colleagues. Promote transparency and explainability. So make sure you understand how it works for everybody, and you build in trust for your staff and for your families that you're working with. Advocate for clear regulation and governance. So, you know, support the Oxford group, support what they're trying to do and what we're trying to do in working with the government, and get some oversight and some policy clear for everybody to work towards. Support reasonable technology suppliers. So again, make sure that, you know, your supply chain is paying attention to these ethics, to these morals, what's going on with their AI, what's going on with the kind of, if, you know, happens with regards to what tools they're using, and look at what tech's out there, see what your colleagues and in other organizations and other care homes are doing, like how's that working for them, like learn from others. Be cautious about risk and content. I think this we've kind of talked a lot about the risks and things to be aware of. So make sure that you have looked and listened and you can plan for those. And engage with the emerging sector, the initiatives, as I mentioned, look at those with lived experience, look at those that have been deployed already, look at evidence already out there, and use that in your favour. And next one, please. And these, as I said, the pack will go out, but these are some key resources, some from our website, some from the other government websites. Look at case studies that we've done about different AI usage, events that we run around it, and latest kind of what's going on with our newsletter, but as well as, the other kind of different organisations that can guide you on this area too. Thank you. Hopefully you caught that.
Eleanor, thank you very much. That was absolutely fantastic. Lots of the things that you've talked about there are the issues that we are working through in Derby City Council. So lots of things about not replacing our staff, how you always have a human in the loop. So that AI will help and support, but it won't be making decisions. It won't be replacing our social workers. And I don't know if anybody else saw it, but we've got digital assistants in Derby called Darcy and Ali. I really like the human on there. That's something I'm going to try and get in somewhere. Eleanor, that was great. Thank you very much. So the next person I'm introducing is Sam. Sam is the technical cyber lead at the Digital Care Hub. Sam, over to you.
Thank you very much for that. I think most of you'll know me. When we go to the next slide, you'll have seen this slide. I'm Sam. I'm the weird hacker that joined Digital Care Hub. Used to be a chef by day and a hacker by night, and now I'm a hacker by day and a chef by night. So I'm going to talk to you about some AI and security. And the things I'm going to go through is data protection, GDPR, consent protocols and ethical considerations, choosing trustworthy tools and vendors, and then a bit about AI and CQC, what you need to know. Originally, when I started writing these slides, I did go into random tree, like forest machine learning. Somebody's emails there. That's a good show of AI. I was going to go into quite a lot of detail of adversarial training and stuff, but that's not what we're going to do today. I'm going to make it as plain English as possible. There is a lot of text. I apologize about that. That's because I'm fairly new to trying to push AI security that's not weird and out there. I'll say that. So if we go to the first one, we'll cover a bit about data protection and GDPR. So this is a bit of a compliance checklist if you're going to adopt AI. You're going to hear a lot of good things about AI today, and there are some amazing things with it. I don't want to be the innovation killer, but I do want to be the one that goes, just think it through. Some regulations haven't fully caught up yet. AI is still relatively new. Machine learning is quite old, but the way AI is being used at scale is happening much quicker than regulators and security professionals like myself can keep up. So while I go through this, I just want you to make sure that these are things that you should be asking, but don't hold it to like this is the absolute mandatory of what you have to do. So I'll quickly go through a bit of GDPR. So understand what types of data you'll be using during any technology's lifestyle. That's for AI and everything, but particularly in regenerative AI. In generative AI, you have to think about that. Determine whether you need consent or approval to use this type of health and care data, what's going in and what's coming out. Establish whether you are a data controller or a data processor, if it's going to be an AI company, or if you are bringing all that in-house, if you are running it locally. Check to see if any project activity should be considered or could be considered research, because then you end up on a different GDPR section that you need to think about. You may need to get further approvals for any clinical investigations on medical devices. Consider whether you will need to share data and how to do that securely and lawfully. This is particularly important when you think about where your data is going to be stored. If it's stored in the UK or EU, it's usually okay. If it's stored outside of that, you need to start thinking about how their laws in the country that your data is being stored, is it strong enough for the GDPR? Sometimes it is, sometimes it isn't. Something to consider though. Ensure you have a legal basis for processing data under the common law duty of confidentiality, data protection action, GDPR UK, all that kind of stuff. Ensure you have a legal basis for processing data. I realize I'm just reading through this. I do apologize. It's a bit boring. We'll go to the next slide. You can read this in your own time. You'll be shared with this later on. Just let you know that originally when I started getting into AI, I realize I'm going off script here, Fiona, but that's tough. I'm going to do it. The original when we started trying to regulate AI, I was part of an EU thing, trying to think of the ways to do it. And genuinely, the first part of regulation that was brought before the EU was Asimov's 3 laws of robotics. That's how it started. And if you don't know Asimov's 3 laws, it's a fictional handbook of robotics. And it's the three laws of a robot may not injure a human being or through inaction allow a human being to come to harm. Second law is a robot must obey the orders given to it by human beings, except where such orders would conflict with the first law. And the third law is a robot must protect its own existence as long as such protection does not conflict with the first or second law. Genuinely, a fictional book, is where the regulation started coming in. Well, let's have a quick look at consent protocols and ethical considerations, which is where things like that came from. Obviously, you've heard from Eleanor things to think about like bias, hallucinations, over-reliance. I want to give you some questions to think about. If you're thinking of implementing AI or you're seeing somebody talk about AI, are the inputs, that could be text, voice, care notes, stored or used for training in any way? I saw somebody in the chat saying that, if you put it, where is it? Yeah, you can turn off chat history when this is switched off. Your conversations won't be saved in history and they won't be used for training in the model. Companies can say that, but there's no guarantee that that happens. I'm not saying that that particular company, OpenAI, I assume we're talking about, doesn't do that, but they can hold metadata. They can see how many text you type in. There's all sorts of ways that they can use the data without using the data. So that's just something to be considerate of if you know what's going on behind the scenes. EU, UK is pretty good on this and going for companies to make sure that they're as safe as they can be. Other things to think about, do end users clearly understand how their data is used, stored and protected? Is consent explicit and informed rather than implied? That's a big one for me. Can users opt out easily without disadvantage? That's quite a big one, especially if you're thinking of making life easier for people. If somebody opts out, are they going to get less care? If it's something quite big in the care sector? The clear process for withdrawing consent at any time. Do you have activity check for bias or for outcomes, particularly for protected groups? Eleanor touched on this. A lot of the AI models are built on very biased information. It's white middle-aged people like myself that it was built on over the past 10, 15 years. It can be misogynistic, it can be racist, it can be biased in medical terms against female. That sound like an incel. It can be biased against women when you look at like historic GPs and stuff like that. Nothing against doctors or anything, but you know how that it can be. All that bias has been pushed into AI as part of its training. Now, it is getting better at filtering out, but that's something that you do have to be aware of. In case of this, is personal data pseudonymized, anonymized, or removed where possible? Safeguarding risks considered, such as misuse, over-reliance, or harmful outputs. That's things like what Grok does. And is there clear human accountability for decisions supported by the system? I think Andy put this really well, is that there's always got to be a human there to get that accountability, to double check that things are going well. Okay, if we move to the next one. Yes, this is a big one of mine. Choosing trustworthy tools and vendors. So if you're looking at AI vendors or suppliers or providers, one thing to remember, the AI company may have certification, but the AI output does not. When you come to looking at companies, when you send them a questionnaire, try and ask, how do you, not do you? So these are some examples that I've put in. Instead of saying, do you encrypt data, they can just say yes, and you go tick, they've passed due diligence. That's not good enough. You can just say, how do you encrypt data in transit and at risk? And they'll hopefully elaborate to how they do it, and then you can tick it as a good due diligence. How do you promote a good security culture in your organization? How do you ensure suitable physical controls are in place? These things just up it a little bit. So the companies that don't really think about security will drop off because they won't be able to answer these very well. And then external verification over marketing language hype. You're going to get a lot of shiny companies saying things like, we use industry standard or our security is state of the art. None of that really means anything. You need to check for external verification. So things like, here's our live Cyber Essentials Plus certificate. Here's our live DSPT publication. Ideally, if they're a large company, you'd want them as a IT supplier as a category 1. If they're a smaller one, it should be okay as a DSPT category 3 other. That might be going a bit far, but just as an idea to think about. And here's our current ISO 27001 certificate, and we are an NCSC, National Cyber Security Center assured provider. Here's our live listing. These are the kind of things you can look at. So we go to the next slide. So yeah, choosing trustworthy tools, due diligence on the AI company plus think about where are the AI data centers based and where does the data travel to and from. We have fairly good legal protections here. The EU has fairly good legal protections. Certain states in the United States have good protections, like California, other ones less so, like Texas. Nothing against Texas if anybody loves it, but those are the kind of things you need to think about. A company in Texas could sell that data and they wouldn't be breaking any laws in Texas, although they would obviously be breaking laws in the UK. So that's the kind of thing you need to look into a little bit. And then due diligence on the AI output as well. Are the coding like that might be a bit much for everyone, sorry, but are the coding libraries the AI use secure? That might be more of an IT question, but it's something to think about. And has the AI considered GDPR principles? It might be trained on all sorts of data. Does it understand GDPR and your processing in that area? Okay, if we go to the next one. This is a lot of text, and I apologize. So I'm going to go a bit backwards in this one. Sadly, we have seen emerging evidence that poor implementation of AI, particularly around data use, consent, and governance, has contributed to downgrading of CQC. The good news is that these risks are extremely manageable. I say the same principles that you do day in, day out with every other piece of tech that you might introduce already I've forgotten how to speak, already underpins good care with what you do with AI. It's just a new tool that you're bringing in, and you just need to think about it as you would any other piece of tech. So I would say here, CQC is not anti-AI, but it does expect the same standards of safety, consent, governance as any other system using care. If they use to support auditing, reporting, or decision-making, service must understand what data is being shared, how it's protected, and what risks are involved. Let's say using AI without a clear risk assessment, consent process, or human oversight, big one again, can raise concerns about data privacy, reliability, and safeguarding, such as bias and things like that. And I think if we go to my final slide, unless I've got it wrong. Yes, okay, so then this will be shared with everyone. So a lot of the stuff I've said is quite a lot. I appreciate that. So I've broken my tools and links into sort of two little sections. There's AI safety. You've got the ICO, Commissioner's Office. As I said, regulations are taking a bit of time to catch up. So the ICO has very helpfully put guidance on AI and data protection. And they've basically pulled everything together so that you can go through it a bit easier. And it showed GDPR, Data Protection Act, and things like that. And it'll give you an idea like, automatic processing of data, links, and all that kind of stuff. Really good one that I found was understanding regulations around digital technology in health and social care. It's more of an NHS one, but it goes really useful. Again, pulls different regulations and gives you some nice, simple steps that you can look at to go through. We ourselves, we have AI in social care progress and plans, some really good stuff there. You talked about the Oxford ethical use variant stuff. There is some good stuff on our site. And then if you're an absolute nerd like me and you want to go behind the scenes and see how machine learning should be protected, then you can go to the government AI cyber security code of practice and see how companies that are doing AI are expected to build these safeguards into their products. And then the due diligence I've put here because I think it's quite useful to know because it's quite easy for me to say, have they got DSPT, have they got Cyber Essential Plus? They could tell you yes, and if you don't know how to check, this is just how you do that. So the first one is very obvious. Most of you'll know DSPT organization search. You can see if they've got a live DSPT publication. Next one is just to see if they've got Cyber Essentials. It's IASME. You can just check if they've got a live Cyber Essentials certificate next to their company. The next two, IAF Search and UCAS, are really good for checking ISO certifications to make sure that they're real because they might have them on the website, but they don't actually have them. They've just put the images there. So those are ones to see if they've got external validation. And then SOC 2 is a bit more cyber specific, but at larger companies, you'd expect to have their SOC published on that site. And then you've got the NCSC, the National Cybersecurity Centre. You've got their products and services search, which means that ones that they've assured, and I've gone through this list, and all the companies on there are good. Like they've gone through quite some severe checks to make sure that they're on there. So if they're on there, it's usually pretty safe bet that they're up there with it. Even if it's just your IT supplier that's on there, it's a good shout. And then I found this quite useful. They've got a supplier assurance questionnaire. Now it's wording a bit of what you should ask, but you can literally just, I mean, you could use AI, feed it in and say, can you spit out a load of questions that I can then send to a potential supplier? So I realize I've absolutely hammered through that, but that's some things to think about. That's me. Thank you very much. That's me in a hoodie. That's what I normally look like when I'm not presenting. Uh, I know I've gone through a lot of security. I do want you to be prepared, but don't be paranoid. Do use this stuff. It's amazing. But just think, have a little question in your mind of like, what if? And that's it. That's it from me.
Sam, that was fantastic. Thank you very much. So I also like a little bit of off-script presenting. So I thought that was great. Thank you very much for that. I think some of the things that you've picked up on there really ring true for us. So when you talked about consent, I think that's absolutely massive in terms of how you're starting to build your approaches, specifically from a provider organization's perspective. Colleagues or everybody on the call, these slides will be shared. So all of those links that Sam's put up will be there for you to go back to. Sam, I think that will be incredibly helpful for people in months to come. So thank you very much for that. Okay, so the next two people that I will introduce you to is a gentleman called Pedro from Northamptonshire Council. Pedro is going to talk you through his experience of using Magic Notes, and then that will be followed by Annie from Amber Care, and he's a home care provider who is using artificial intelligence to reduce falls. Pedro, I'll come to you first.
Thank you, Andy, and morning, everyone. I'm glad you mentioned you like to kind of take it a little bit outside of the presentation because we're about to freestyle it in a minute. So my name is Pedro. I work for Northampton, the digital and innovation lead, specifically around adult social care. And today I'm going to be talking to you about Magic Notes. So can you, next slide, please? So Magic Notes is the easiest way to explain it is a transcription tool, and it is a system or software we use to record conversations either face-to-face or through Teams or similar setting as we're having now. And similar to probably use Teams, transcription, the main difference is the fact that not only we can carry them face-to-face, we can choose the output and edit what the output looks like. It allows us as well to use either or mobile phones or laptops, so the situation can change. So most commonly what we have in Northamptonshire is our adult social care team going out to assess for a variety of different reasons. They take their devices with them, and then they obviously talk to the person, explain what the solution looks like, gain the consent, and once the conversation starts, they will start the recording. The main potential benefits, as you can imagine, is the fact that they no longer need to be taking notes. They don't need to take time out of the person's conversation or have to follow a specific conversation. They can just simply talk to the person. It will be recorded, and at the end of it, they can edit it and make it more appropriate. Can I have the next slide, please? You can, 4 of them, I think. Yeah, perfect. So before we started with Magic Notes, we had a few ambitions. We wanted to look into reducing time spent in admin. We wanted to improve the quality and practice of social workers, so the time they spend with customers, and rather than taking time to take notes, they're focusing on them. How long it takes us to complete a care act assessment, for example, how long it takes us to get back to the person following an assessment, and specifically improving the workforce and the well-being, because we had, for example, Dragon that we use for people who are neurodiverse, people have dyslexia, where they were using different programs to read, to chat, to complete certain tasks on their behalf. So we were looking as well all these options to do. So what I thought would be a good idea, and prior to this conversation we spoke with Andy and Andy agreed with, is to demonstrate, is to almost have a live demo of what the solution looks like. So me and Andy, we didn't rehearse this, we're gonna freestyle it, and I'm gonna try and make it as normal as it would be. So if I was visiting Andy in his home, I would explain what the solution looks like, I would gain his consent prior to start the recording, and then before I start the recording, what I will do is I will get his consent as well, so it's recorded, and I will ask Andy to introduce themselves. So the reason for the introduction is even myself, who's done over 100 of different demos, the solution doesn't know who I am, so it doesn't learn specifically from what has been recorded. So I'm not going to share my screen just yet, so we can leave it on that. What I'm going to do is just have my screen on the back end to start the conversation. And Andy, are you okay? Do you want me to call you Andy? Do you have a specific name?
Yeah, Andy is my name, so I'm really comfortable with that.
Fantastic, Andy. So what I'll do is I'll guide you through, I'll count to 3, but I'll guide you through set up conversation, make it as weird as you want it. I'll try and take it about 5-6 minutes, and then we'll come back, and then I'll share my screen to show what the back end looks like. Is that okay?
Sounds good.
Perfect. So in 3, 2, 1. So good morning, Andy. Thank you very much for inviting me to your lovely home. My name is Pedro. I am a social worker for North Northants, and I'm here today to have a quick conversation with you. Before we start, can you introduce yourself and confirm you're happy for me to record this conversation?
Hi, Pedro. So my name is Andy Appleyard. It is a lovely home. It is a little bit messy at the moment, so please excuse some of that. Can I ask what you'll be recording and why you'll be recording it?
So like I've explained, it's just so I can focus specifically on us and on you in this conversation, so I don't have to take notes. And essentially, this just helps me to remember everything we discussed, and makes me a little bit more efficient in terms of getting back to you with information we just discussed and getting the process started for potentially support that we can provide. Is that okay?
So that makes sense. Who else will see the recording?
It's just myself. And
Okay.
you, and obviously I can share the recording with you if you want to. I can share the transcript. I can also share the audio if you prefer, but it's just me and you, and then it will be automatically deleted within 28 days.
Okay, that sounds
okay.
I'm okay
Fantastic.
with that.
So the reason I'm here, Andy, is because your GP, Dr. David Beckham, put a referral through saying that you were taking your Christmas lights out, climbing on step ladder, having a fall, and from that fall you injured your hip, and you were found by your neighbors, Cheryl, and she called an ambulance, took you to hospital, and then obviously you're now back home. But Dr. Beckham was saying that you're struggling a little bit with your day-to-day activities. So what I'm trying to find out is what your kind of worst day looks like. So in the morning, for example, getting in and out of bed, going to the bathroom, utilizing the stairs. How are you kind of managing that?
Okay. So yeah, you're right. My doctor is David Beckham, and it was my neighbour Cheryl Cole that found me. Just so it's really clear on the recording, can we make sure that everyone knows, or the recording states that I was taking my Christmas lights down in January, not in February? I don't want anyone to think that I'm lazy in that way.
Of course, yeah. I'll make sure that.
Thank you. I fell from a reasonably high height, and like you say, I had a real problem with my hip. I couldn't get up. Things are getting better for me, but I'm really, really struggling to get up the stairs at the moment.
Okay.
I've got a shower that's in my bath. I do prefer to have a shower over a bath, but it's really tricky for me to get in and out of the bath to have the shower at the moment. So that's really problematic. And then, if I'm honest, just after, I can't do things for as long as I used to be able to. So standing for a long period of time, even if that's just kind of trying to make myself something to eat, I'm tending to do things like make sandwiches because they're quicker. It means that I'm not on my feet for as long.
Okay, that makes a lot of sense. So you mentioned obviously going up the stairs, but I'm assuming going down the stairs is the same issue.
Yeah, just generally the stairs are really tricky for me now.
Do you have to hold on your handrails, or do you kind of slide down on your bottom?
I don't have a handrail.
You don't have a handrail.
So yeah, sometimes I'm on my knees to get up. Sometimes I'm on my bottom to shuffle down. Yeah, it's I don't look as slick as I used to when I'm walking down the stairs.
That's absolutely fine. You also mentioned obviously standing for long periods of time is complicated. I'm assuming obviously from cooking and preparing meals. You mentioned obviously making sandwich, but what about ordering food? Are you managing that yourself? Do you order it online? Have you got any family members or neighbors that currently support you with that?
So I don't really order anything online. I'm not really that's not something that I've ever done before. I do have a family member that pops round every week on a Saturday. They bring me certain things.
Mhm.
And my neighbour, if I have like the odd problem, when my neighbour pops round, she just checks in to kind of make sure I'm okay. She usually pops round around 6 o'clock every
Okay.
day. If I need anything like sugar or tea bags or whatever, she'll grab me a few.
And what's your family name? Who are they to you?
So
The
what's my
person who supports you, the person that comes and supports you with the
my
the
son
shopping.
comes my son comes round. His name's Steve.
Steve. So Steve comes around and helps you. Okay. Now, Dr. Beckham also mentioned you are a pillar of your community, obviously participating in the Olympic medal finalists in
Figure skating.
figure skating. Yeah, that's exactly what I was picking up
Yeah.
from my notes. And obviously you were part of your community, going out into schools, talking about your experience. I'm assuming, obviously, since you injured your hip and your mobility has decreased, that has you've not been able to continue to do that. Is that correct, or have you found a way to do it and still be involved within the community?
No, so I can't go into schools at the moment. I can't kind of go to any organised functions. I am a bit of a local celebrity. Everybody is very impressed with my figure skating accolades. And I'm not able to go to the local ponds and show people my skating
Of
ability,
course.
which is having, if I'm honest, it is impacting on my mental health quite a lot. I feel like my world's got a lot smaller.
Yep, of course, that makes sense. So obviously from what we discussed today, what I would like to do is suggest some referrals I can make on your behalf. The first one would be to the community occupational therapy team, specifically to assess your accessibility. So from your stairs, from the bath, looking in the house, providing with some potentially devices that and kit that can help you mobilize or make some changes to the property. Not everything is free, but they would explain depending on the kind of different systems that they make a recommendation. If it is a major or minor adaptation, then we might have to go through a financial route, etc. But they will be discussed with you, and you can then make a decision whether it's appropriate or not. The other referral I would like to make is to the community physio, again to try and get you back up to your feet, to make you as mobile as possible. The third one, because you spent some time on the floor, I was wondering if you would be happy for me to make a referral to the to the assistive technology team, so they can provide you some gadgets and devices in case it happens again. You can call for help, and someone at least will be alerted, and you won't spend too much time on the floor. And finally, we spoke about two things. One, obviously, you're struggling with your day-to-day, so I would like to make a referral to the reablement team and the team that would come in for about 6 weeks, try and bring you up to speed, support you to gain access and build some strength, and finally look at some teams or some voluntary services that can help you gain access to the community, pick you up from home, help you get back into talking about the experiences, because it was quite helpful. Does that sound okay with you?
That sounds really good. I suppose the only concern that I've got is being one of the best figure skaters in the world is really fulfilling, or was really fulfilling for me. It didn't mean that I made a significant amount of money in my life.
Yeah.
So I am a little bit worried about costs. So being able to
Okay.
have some conversations just about what's available would be
Yeah.
really helpful.
Absolutely fine. And what I can guarantee is that all the teams that we put the referral through, they would discuss if there is any cost attached, and nothing would go through unless you decide to, and it would be financially tested as well. So it's means tested rather than so it follows a process in that regard.
Okay. Can I ask one more question? It does seem like a lot of people are going to be coming to see me, which is, it's a little bit daunting. And I suppose I'm just really interested in keeping my privacy. As we've talked about, I am really well thought of in the local community because of my previous lifestyle. So just making sure that people aren't talking about me losing some of my skills or my abilities or my life changing.
Yeah, we can definitely add a note specifically to this assessment to make sure they keep it as private as possible if you want. And then I can add a note to your customer management system entry to say, keep this in between, and obviously avoid making any comments outside the organization. But yeah, is that okay?
That sounds great, Pedro. Thank you.
Fantastic. What I'll also do, I'll send you a letter, and I'll send a letter to Dr. Beckham as well, explaining the conversation we just had.
Thanks very much.
Thank you. Okay, that's fantastic, Andy. I knew you'd be the right person. Right, let me share my screen. Give me a second. Can you see my screen? Magic Notes screen, I mean.
We can.
Yeah, fantastic. So just so you understand, there's a couple of different things here. What you're going to see, these are all demos. So these are just, there's no privacy in here. So first things first is just what I was doing is I was recording the conversation. And like I said, I can record it either through Teams or face-to-face. Now, this is where all my notes are here, and this is all the assessments I've done in the last week, and the other ones have been deleted. And then we have the date here when it was going to be deleted. Now, it has, oops, I clicked on the note. So he's still drafting Andy's note. So usually it takes just a few minutes, and once it's done, we can dive into it, and I can explain to you a little bit of what it looks like. So there it is. So first things first, he chose the care assessment template. I'm just going to change it quickly to general meeting. And this is one of the things, the major benefits of this solution is that I can choose as many, or I can create as many templates for the organization as I see fit. So I don't have, I can choose care assessments. We have, for example, me time for supervisions. We have concise case notes, we have a range of different things, care planning. So we've created all of them, and we can change them on the fly quite quickly, and then it just rewrites it. Once he picks up, I'm just going to show you, first of all, the recording. So we have a full copy of the transcript here, and I can download the audio, or I can just listen to it back. So I can listen to it if there's anything I've missed. Now, we didn't specify any topics, and I'm just going to go through this rather quickly so you understand what it is. But the topics that I've picked up is based on the conversation me and Handy just had. So we have, for example, the introduction to the visit. It says, I'm from North Northants, visiting Andy at their home, following a referral from Andy's GP, Dr. David Beckham. The purpose of the visit was to discuss Andy's situation and challenges after a recent fall. We discussed about the incident. We know it was found by his neighbor, Cheryl, who then called an ambulance. He was taken to hospital. And Andy did specify that the incident occurred in January, not in February, as they wanted to ensure this was accurately recorded. We then talk about the assessment of daily living activities and the things they were struggling with, specifically with the stairs, the shower, and also the ability to cook because of standing for long periods of time. We then spoke a little bit about Steve, Andy's son, and the fact that he visits on a weekly basis, with Cheryl supporting Andy every day at 6 p.m. Andy expressed or specifically mentioned the impact on his mental health because of the fact that he's not able to engage with the community as much as he did. And then we also spoke about the different referrals and services. So this comes down at the end to me to say, these are all the actions I'm going to make on behalf of Andy. Now, on the right side, if you use Copilot or a chatbot of sorts, it's very similar. So one thing I like to do about this is to say include direct quotes from Andy and make them bold. Okay, so what it's going to do is going to rewrite the full assessment, and then is going to include direct quotes from Andy in areas that deems appropriate. It'll make them bold so they're easy to identify. And what it does, it makes it a bit more person-centered to us, right? So, for example, here we now have, just so it's clear on the recording, going to make sure that everyone knows, I was taking my Christmas lights now in January, not Feb. Let me see if I can find the figure skating thing. I'm a bit of a local celebrity. Everybody's impressed with my figure skating accolades. I can't go into schools at the moment. So it makes it more person-centered. Now, I could also say, because I was going to do this, I can draft a letter to GP and do not include direct quotes. Okay. And then what we will do is just draft me a letter automatically based on the conversation we just had with Andy and write it on my behalf. And if I wanted this letter to be in any language, I'll just wait for it to be done. And I can also translate GP letter to Spanish. Now I've got a letter that can be translated or is translated to Spanish. And then again, same principle, reply. If I wrote a letter directly to Andy, I could also make it easy read. So again, it's a principle. What I usually say to our social working team is that this solution doesn't do the job for them. It does 92% of it. For 94, it's still their responsibility at the end to make sure that the information here is correct, make any changes that they need to do. They can add a specific topic here if they want to. So Andy spoke about his mental health. I want to add a further topic to it, and then I can cover it. Now, if I'm not entirely sure what services are available to Andy, I can say suggest services to Andy, and what it does, it's built on something we call the knowledge base, which is a set of websites that we have that built in within the council, and then it just mentions a few services. They will be probably exactly the same as that we've discussed. So technology, pre-enablement, community, what we discussed. So that is more or less what Magic Notes does. We have different ways of working it. I think the main benefits of it is they're coming here. As you can see, I can choose any template from here, automatically ports it, and saves me a huge amount of time. Now I'll stop sharing. If we could go back to
Pedro, that is absolutely fantastic, and I can see questions are coming up, but we're getting a bit tight on time.
Yeah, I'll just do quickly the benefits we've seen, and then we can share the slides with just the rest of the feedback. So I'll stop sharing my screen. Yeah, so these were fantastic. I can see them too. So these were the baseline findings we had. So initially what we had was just trying to find out exactly where we were, how long it takes us to complete, or how much time we spend in admin, what our quality ratings were, how long does it take us to submit or get, perform or say or give information back, and also what kind of workforce where we were. So we asked all these questions before we went live, and the next slide will give us the trial a few 4 times. Yep, perfect. So you can see significant savings and efficiencies were created. I think the 45 times saving per assessment is massive. I think if anyone works in adult social care, and specifically the Care Act assessment, know how long it can take. So this was a trial of 30 odd adult social care workers that provide us this information. We also, quality of notes has improved. I know for a fact that some of the assessments we completed were used in CQC because of the quality of them, or quality teams found that they covered pretty much everything. And also in timeless, and this is really important, is that we didn't leave people waiting for too long in terms of the once we completed, how long it took us to get the information to them. And as you can see, 85%. The rest of the slide, I think we can skip. It's just feedback and information that we collected from our colleagues. You can see, and then, yeah, I mean, happy to answer any questions as we go along.
Pedro, that was fantastic. Thank you very much. Collie, to everybody on the call, can I just say, please, as many questions as you can put in the Q&A function for us will allow us to be able to give you feedback. If we can't do it today, we'll come back to you at a later time. So if you do have questions, please get them in the Q&A function. And if you want to direct your questions at Pedro or at Sam or at Anne as we go through, please do that. But the next person I'm going to introduce is Anne to just take us through AI Eyes for Safer Care.
Hi, Andy, and hi, everybody. My husband and I own 2 care homes, 2 quite small care homes in the UK. And we have been struggling with falls, like everybody else has. We can just go to the next slide. Those are our 2 lovely homes. And as most care home owners, we're very responsible, and we really enjoy looking after our residents. And falls has really been a big, big challenge for us with everything that is involved in that. So we were looking for a system that could assist us. I did this presentation last year at the Care Show in Birmingham, and the reason why I did that is when we had Verso installed, we had amazing results from it. Can I just have the next slide? So
sorry to interrupt, Annie. There's a few people just saying your sound isn't very clear. I wonder if maybe you could go a little closer to the microphone and see if that makes a difference.
Okay, sure.
Sorry.
No, no problem. Is that a little bit better?
Just go again, Annie.
Is that better?
How's everyone finding that? Was that clearer? Okay, generally a bit better,
Great.
so that's good. Oh, okay,
Yeah.
apart from one, not really. We'll try again, and if I have to interrupt, I'll let you know. Okay.
Okay, sure. So what happened last year, just before the care show, is that we had in June a month with no falls. And the reason why I start with this part of the story is that we had a mock inspector that came and did a mock inspection at our home, and he said that it was physically not possible. This is like we had to be fiddling with something somewhere. I was really quite indignant and decided that I have to go through all our statistics to make sure that this is actually the issue, you know, that the system is actually working for us. So as I did all the statistics and I compared one year with the next year, I actually saw that we were consistently below the falls that we had the year before, and that the total falls really, really reduced. And I could see that the June falls actually came down to 0. And it wasn't just the month of June, it actually started in the last week of May and then went over into July. So we sort of had a 6-week period of no falls. The inspector was correct in his doubtful sort of acceptance of these statistics, because it was the same people that we had before the no falls and after the no falls. So we had people that had falls before this period, and we had people that had falls after this period. So basically, I had to go and look at exactly what happened here. And I just have the next slide. So, yeah, just the previous slide, sorry. So these monitors are installed in the bedrooms. So in each bedroom, there is a camera installed in the ceiling that uses AI to detect when somebody is about to get out of bed or sort of about to roll out of bed or stays too long in their ensuite bathroom. We've got various protocols that we set up because we know our residents quite well. And then the AI will send us a message to tell us when these protocols are breached, which gives our staff time to go into the bedroom and then see or help. So, for instance, if we know Mavis always falls when she gets out of bed because she forgets to use a Zimmer frame, as soon as her knee goes over the edge of the bed, somebody can go in and say, "Hi, Mavis, how can we help you? You know, do you need help? Where do you want to go?" A lot of people felt that was quite invasive when I've done these presentations, but of course we set it as per each resident. It's very person-centered. If somebody doesn't need any help, then obviously we have no protocols or no breaches or no alerts set up for their rooms. So what we then realized is that the staff were basically alerted before a fall happened, which was our point when we looked for a system to help us. We didn't want to be alerted after a fall happened, which is what most of the systems that we had in place said, whether it was a bed going down to the floor or infrared beams or anything like that. We wanted, or fall mats, we wanted to know just before. So this company from Finland, there's a vision, we found them at the care show. They sort of answered a lot of this, and then after the pilot study, we installed it. Now, as you can see, the bedroom falls have dropped down completely. And it's not that we can prevent all falls, because they will always be the first fall. But what this AI helped us is to know how did people fall. Because most of our falls were unwitnessed falls. And our staff, if we've got enough staff, they're always present, they're in the corridors, they go in and out of the rooms, the lounges, and so on. But we can't have a 24/7 one-on-one monitoring system. But this allowed us to have this. So now we can see if somebody has a fall, how did they fall and why did they fall, so that we can then put in the right either equipment or protocols or things like that to prevent further falls. But there was something else that happened. So as I looked at my statistics, can I just have the next slide? There was a very interesting thing that happened, is that our falls reduced in other areas that are not monitored as well. And luckily for me, I have a training and development manager who has done her master's in behavioral science. And she could then explain to me what happened here, because I can understand that if we have a monitoring system that looks at the falls and alerts us before a fall happens, why did the falls reduce in other areas of the home as well? So this is what's called basically a positive punishment. So as the staff explained to us, and it was really by chance that talking to the staff that we sort of got behind this, they were changing their behavior to avoid receiving the alerts on their phones. We use PCS, so the system the alerts come through to their handheld devices. Because they felt this vibration and the beep on the devices in their pockets every time somebody breached either getting out of bed or getting up or alerting us. They were going into rooms, for instance, in the morning, before a person sort of gets up and normally falls. So residents that get up early in the morning need help to go to the loo or want a cup of tea or are restless. Those residents were basically helped first. So we basically found that even in the corridors, when people were moving people into the lounge, they realized which residents were the vulnerable ones, high risk falls. But this wasn't something that was led by a senior or a meeting or anything like this. This was basically something that happened automatically due to the AI alerting people constantly. So AI was basically teaching our staff to act ahead of time. So that to us was like the most revolutionary thing that happened on this whole journey with AI and the monitoring system. So just to explain to you how this all works, just in terms of what Sam also said, could I just have the next slide? So we can see that our results are quite good. So we've reduced our falls, and I think this is in line with any of these fall reducing systems that we get specifically from the Scandinavian countries. I think this is proven beyond anything. Versa does that, and all the other systems does it as well. Can I just have the next slide? And the next. Yeah, I think we can skip this slide. I think we all know this, how much it's costing. Yes, so what happens is there's a camera in the ceiling, and I just want to emphasize this is not CCTV. So the camera is a digital camera, and it's only the bits that go in, so our ones and our zeros that go in. It's analyzed by AI according to the protocols that we've set per room. We don't want somebody to get up, or we don't want somebody to roll out of bed, or we are quite worried about somebody walking around and going into their ensuite, because that's normally where their calls happen. And then the alert is sent as soon as that is reached. This division is fully GDPR compliant. And because it is just bits of information going in and a constant calculation, there is no recording as such until a breach is made. And then the company will have 19 frames around that event so that you can just see, it forms like a little movie of 19 frames of how the fall happened. If that is not looked at, then it is just deleted. So there's no, you can't go back to it, you can't keep it, you can't rewind, you can't ever go back to it and say, for instance, send it to the coroner. So I know a lot of care homes that I've spoken to wanted CCTV for coroner's reports and for insurance. This is not it. So this is basically just constantly keeping sort of AI eyes on a resident to send an alert. Once you get the 19 frames, if you request it, and this is a 72-hour period, I believe, that 72-hour period is just to take us over the weekend. Then we can see what is the reason why somebody fell. Did they not grab their dimmer frame? Did they not use something? Were they confused? And then we can put the right protocols in place. And then, the other thing is also is that all this data is not put up in a cloud. We have a server on our premises. So each home has got a server where all the data is kept and fed to. And even the company in Finland needs our permission to access that server to look at things if anything goes wrong, or they need to do an update, or they need to verify something. So it is Finnish, it is part of Europe. So it's a fully GDPR compliant system. Is that the next? So this is a little video of what the AI sees. And what you ask for your 19 frames, it will look something like that. So it's completely anonymized. And you can't detect the person, it's just a little stick figure. The room, so if you get the 19 frames, it will look like this. It's a round thing because it's basically a camera, it's a fisheye camera in the ceiling. And then you can then basically see sort of what happens. It will also show you, not from this video, but it will also show you when somebody walks in. So when a carer walks in to help or to assist. And as soon as the second person walks in, of course, it will stop recording, or it will stop monitoring. I should say that. I should have used the word recording, but it stops monitoring as soon as a carer walks into the room, I think. So we have been asked if this is not an invasion of privacy. We don't believe that it is, because we think we actually provide residents with more privacy. So we don't have people opening the door and going in and out, hey, Joe, are you okay? Do you need anything? It allows people to sleep better at night. We don't have to wake people up at night. I've discussed, there's no CCTV. So it's a completely different system of just bits of information that is digitized, and it's just put together in the form of a picture with a stick figure for you just to see what has happened. We've been asked if staff will still go around, or will they just sit and watch their phones or devices? Because we never see that picture except if there's a breach. So there's no monitor or camera where you can watch what people are doing, because it's not CCTV. So there's nothing to watch on their devices. And we have found our staff are still in and out of the rooms, where they are. Nobody sits sort of in the senior's office and just try and watch a monitor, because there is nothing to watch on the monitor. It's only when the alert comes through, and the alert comes through written on their phone. a little sound and it says call alert or bed exit alert or chair alert for room 5 or room 6 or room 17, and then they can quickly go and help. What happens when staff don't react to an alert? The same thing. If somebody presses a button and uses the normal nurse call, we look at it and we just treat it in the same way. So we can see when staff don't react to it, so we can see the reaction time as well. And then we investigate and we see what is the reason. Not enough staff on the floor, they were busy with somebody else, whatever the reason is, and then we take it from there. So we still take full responsibility for our staff and their actions and their reactions, like we would do with any other monitoring device. Next slide, please. So what we have found a massive, massive big advantage with our staff is that they've actually said to us, you can take a lot of technology away, but please don't take Verso away. So they feel very assured. They know that the residents are being monitored. And so if they are with one resident, especially at night when we have reduced staff, they know that they will be alerted if anything happens to a resident in another part of the home. So they sort of can take their time, make sure that residents are comfortable and really looked after. Our residents are also benefiting from a much calmer atmosphere. So the whole home has sort of calmed down. So we don't have beeps going in and people running to and fro and that sort of thing. The next of kin have been incredibly supportive of the system because most people land up with us because they had a fall at home. So for them, this is like quite revolutionary, but also reassuring. So when we explained it to them, when they put their loved ones in with us, they haven't had one person saying, I don't want it. So they've all signed their consent forms and we've done all the risk assessments with their blessing. I've never had anybody say, I don't want it, although we can switch it off if somebody particularly does not want it. These less falls has really, really helped the home. I cannot say how much it has really helped the staff and our home overall. It's a completely different atmosphere and a completely different way of caring and looking after vulnerable people. The next slide. So these are just, having the carer at the right time, at the right place. I think this is just what I've said before. What I really like to, I think it's the next slide. That's just the future that I really want to talk about. So now Verso or these AI systems that do the fall detection are very good at monitoring movement. But the next phase of this is going to be non-movement, which as a care owner is something that I'm really interested in. So the Gen 3 is coming out now in this first quarter. We're just waiting for it to be rolled out. But that is when we can see when somebody is not moving. So that would come and help with terms of bed sores. So if we can see when somebody turns themselves or doesn't have stopped turning themselves, that would give us great insight to prevent bed sores. It can also see when somebody has a stroke or if somebody is incredibly depressed. So if somebody is sitting in their chair and have not moved, it will send an alert to the staff to say, Rose is sitting in her chair, she has not moved for the last 6 hours. And we could then divert and say, okay, let's come up with a plan. Let's see exactly what is going on here. Which to me is quite exciting. I actually think that this type of AI monitoring eventually will replace nurse call systems by way of people would be able to wave or shout or ask, and the system will pick it up and then send the staff to go and do the care when needed. I think it will give us a very good indication of where are the bottlenecks, what times of the day are really necessary. They're planning things like incontinence monitoring that can actually pick things up with changes in the color of sheets, uncomfortableness. So I think this is just the beginning stages of monitoring and using AI to help us provide the care when it is actually needed.
Annie, this sounds fantastic, but can I give you a 1 minute warning for timing? Is that okay?
Sure. So I
Thank
think
you.
I'm nearly at the end. This is my last slide. So Verso, why we chose Verso, there are many others out, is that you can use any existing camera. That is one of the big things. So it's had a huge big cost benefit for us. So it's not a vendor locked in camera or recording device. It's just a normal fisheye camera. You can use existing cameras if you have them installed. It can be 10 years old. It's the software that is important, not really the camera. It's got really, really good accuracy. That's why they use cameras and not infrared or any of the other technologies that are out there. It's very affordable. And there's, like, as they say, there are cameras everywhere in the world now. So it's being rolled out. It is a very accepted way of monitoring and giving data. And that has got a cost implication as well. Minimum setup, and it's very long lasting.
Annie,
That's it for me.
that was fantastic. You have had lots of comments in the chat and lots of questions. Again, if I can just remind everybody, if you've got specific questions for Annie, if you can put them into the Q&A, and we'll have some time to go through some of those later. Annie, I thought you did a great job there. And the questions around how do we ensure that somebody is safe whilst not depriving of their liberty? What are the different things we can do in those space? I think that's a very, very interesting product. So thank you very, very much for talking to us today. Colleagues, thank you. Last but certainly in nowhere least, I've got Shirley Way from Skills for Care. She is head of the region. And Shirley is going to talk to you about digital skills development in adult social care.
No, thank you very much, Andy, and thanks to all the speakers. Certainly, Annie, thank you for joining us off your holiday as well. Found that absolutely fascinating, to the work that's been done. And I'm hoping most of you are aware of the workforce strategy for adult social care. We're coming up to our 2-year anniversary of that. And within that, it highlights the increased digital skills as a priority. If the sector is able to satisfy the increasing demand of high quality social care services. And as I said, today it's been absolutely fascinating and really interesting to listen to the developments and all the innovation that's around and how people are embedding some of this technology, NNI and AI into their organisation. But what we've got to do alongside this is ensure that whilst we're embedding technology, is actually do our workforce have the capabilities and confidence in regarding the use of it? So I'm going to just very briefly go through some information to help you on the journey of developing your teams. As we said, it's important to ensure that we're increasing the digital skills as we move forward into the future of technology and AI. So going to the next slide, the Adult Social Care Digital Skills Framework. This is a free resource to help support the development of digital skills across the adult social care sector. And, it's been embedded as well into the care workforce pathway. So we can start to look at how it's embedded in each of the roles. And we've got great new roles coming on, such as the care technologist. The digital skills framework includes 7 themes which relate to effective digital working. So I'll just run very quickly through the titles. I'm not going into any details. So we've got using technology to support person-centered care, technical skills for using technology, communicating through technology, using and managing data, being safe and secure online, ethical use of technology, and then finally digital learning, development and well-being. So each of these themes has 2 levels. So the first level is the digital skills for all. So this is for staff at every level of digital experience and where they should aim to develop the basic skills. And then the second level is the go further. So it's skills for those working in or wanting maybe to progress into supervisory, into management or leadership roles, maybe some of the digital champions or business support roles. And then alongside this, and when you get these slides, each of those boxes have the links through for you to all the information that sit behind it. So there's 2 assessment tools for the framework that was launched in April last year. Now, these assessment tools help you to benchmark and baseline yourselves around the digital capabilities and improvement. It helps you understand achievements, but also it helps you to identify gaps as well. And it will support the development of your digital vision and really help you make a case for change if need be. So, as we said, the 2 main self-assessment tools. First one is the digital skills self-assessment tool for adult social care. And that's designed to assess the digital knowledge and skills of those working in the social care sector. And that's against the 7 themes of the framework. And it will help people identify their own individual areas of learning and personal skills development. And also it will then steer and signpost them to information, to training and resources to help with that. And that's something that can be used within people's individual development plans. So as managers can start to use this and map out the learning and development required for that individual care worker. And then the second one is more around the organisation. So what good looks like, the self-assessment tool for adult social care providers. And this helps care providers to assess and review, again, their organisation against 7 success measures and standards of good practice within the what good looks like guidance. And again, it will signpost to further support. So you can find out lots and lots of more information if you click through to all of these. So when you're looking at the skills of the individual, one place that they will potentially be directed to is the digital e-learning modules. Now, these were used to develop their knowledge and confidence in using digital technology. And Skills for Care developed a suite of free to access, bite-sized digital skills e-learning modules, and they are in line with the digital skills framework. So, as we said, these modules designed to support people working in the sector to gain that knowledge and that understanding, and importantly, as I said, that confidence in using digital data and technology to support them in delivering good quality care and support. Each module, it's short and it has a set of 3 learning chapters and objectives. So they're not huge pieces of learning. They're actually easy for people to pick up as and when, and also to meet their individual needs. The next one, the most important development then, is moving on, and I've got more detail on the next slide, is the Level 5 Digital Leadership Award. Now that's available to deputies, registered managers, and any other senior staff who are interested in increasing their knowledge around digital leadership. And again, if you are looking, alongside the care workforce pathway, it may be one of the new roles like the care technologist. This would be ideal for them to look at once they've maybe completed what's being developed as there's a level 3 being developed at the moment for them. So as a result of completing the Digital Leadership Award, adult social care leaders and managers will have greater confidence as well as capabilities to lead the use of technology in the delivery of care and support in their organisation, and importantly, to improve the quality of life and outcomes for those who draw on that care and support. And I think we've seen, an ideal example with Annie and the technology that's used there, and how she showed the benefits, not just for the people who draw on care and support, but also for the workforce as well. So this Level 5 award will also enable leaders to drive the digitisation within their organisation. It will help them to lead and support the wider workforce to develop the skills and confidence with technology. And importantly, it will lead that positive culture of learning and that continuous improvement of care services. So we'll help you looking at where you are now, where you need to move to, what do you need to adapt to do that, where do you need some support to do it, and how will you work together and set that action plan in place. It focuses mainly on 3 core areas. So the first one is the use of technology and data in adult social care. And obviously, those of you who work with us at Skills for Care, you know the importance that we stress around the use of workforce intelligence and data to inform our work and to influence change. One of the other core areas that look at implementing technology in adult social care, looking specifically at your organisation. And then, as I said, the third one will be based around leading change and learning and improvement in adult social care. And the beauty of this as well is that actually it is one of the eligible elements for the Learning and Development Support Scheme, the LDSS fund, and you'd be able to claim up to £525 back for each award. So, what can we do after today to increase your digital confidence? Hope for you, your services and your teams. That there's just a few ideas on screens. You know, start talking, get people to talk about, because I think some people have that lack of confidence and maybe don't, I mean, you know, I always remember many, many years ago, you know, first using the internet, I'm that old, I'm thinking, oh my God, I press a button, I'm going to break it, you know, and that panic of, oh no, I can't touch it. And people are still maybe having that, even if they're confident around the use of smartphones, around computers. When it comes to maybe something in work, we talked about magic notes, we've got the Verso we looked at today, people start to maybe have that panic again about, oh no, I can't because I don't know how to do it. Talk about it, involve everyone, be very open about it, be creative in the learning. Attend your networks and talk to others. That's how I found out about Annie and the great work that they were doing. And Annie's been able to share that with lots of other nominated individuals in their networks. Look at maybe having digital champions. As it says, make it normal. You know, have that conversation. It's in general conversation each day. Digital doesn't always have to be scary, and we want to encourage more comfortable and confident approach to technology in the sector. Digital working in adult social care can significantly, as we know, improve how people are supported and enhance the quality, efficiency, and importantly, the personalisation of care. And just on the last slide is just a few further links. So when you receive these, that you can link through both to ourselves and to the Digital Care Hub. And there is a link there, you know, if you do want to, we talked about, you know, getting involved and finding out what peers are doing. Make sure that each and every one of you are linked in to your local registered managers networks, nominated individual networks, etc. And if you're unsure about that, at least be linked into your locality manager within your areas. And the link is there so you can find out which person is in your area. So thank you very much. Thanks, Andy.
Shirley, that was absolutely fantastic. Thank you very much. I'm going to go to questions now. So I'm going to ask everybody that's been involved, everybody that's presented, to come in for the question that they think specifically relates to them, if I can't direct it. So the first question that I'm going to ask, Shirley, because I've got you on the screen, will just come to you if that's okay. So I've got a question from a lady called Paula Chandler. Sorry, Paula, didn't read the A at the end there. And that is there any training for very basic skills for using a computer, as some staff refuse to even use a computer, let alone AI?
Yeah, I mean, Skills for Care don't have any. And I think Fiona might be best placed to answer in regards to the digital care hub. But certainly within your local areas, I do know that there's lots of adult skills community about accessing, those first stages. So certainly within local areas, I do know there's a number of online. Myself, actually, funny enough, I've just signed up for a free course around the basics in AI because I do use it, but actually I've not had any training in it. So I've just come across a free opportunity that's available through one of the learning providers that they offer. Barclays Eagles offer some training as well around basics, skills around using the internet, using some of the packages. So certainly have a word with your local colleges, your adult and skills, community skills teams. Talk to some of the local care providers. Talk to someone like myself so I certainly know. I used to be, before head of region, locality manager in Staffordshire, Stoke and the Black Country. So I know within those areas there are organisations that offer that kind of training. But I don't know if Eleanor or Fiona might have other
Thanks, Shirley.
ideas.
Similar for us. I mean, we've got specific e-learning linked to more data protection and cybersecurity, so it's a little bit more niche. But I think you've given really good advice there, Shirley. I think I would concur. Look in your local network. Barclays Digital Eagles is exactly who I was thinking of for the more basic skills. The government website has got various signposting. So what I'll try and do is when we send the slides out, I'll try and collate a little list of some of the free training resources that there are. I'll go away and put those to come out with the slides.
Fiona, Shelley, thank you very much. Pedro, I'm going to try and combine a couple and come to you. So one of the questions is, does Magic Notes have an integration into any specific software? And then the second part of that is, can we create our own document layout that will be filled in from the transcript?
Yeah, so first question, no, it doesn't. Like we said today, I think we don't want it. There is a possibility we could, but we don't want it. The reason for that is that we want a human in the loop to make sure that they will copy the information, they will review the information first before they copy into whatever customer management system is. So that's why we haven't integrated yet. The second one, yes, you can do any template you want, anything that is you use, and it will just pull into whatever format. Like I said, we have probably about 20-25, including our therapy assessments as well. And essentially they're quite easy to do, and you're constantly reiterating on them if needed.
Wonderful. Whilst I've got you, I'm going to try and condense another question. It's about any cost analysis that you've done in terms of Magic Notes. An individual is looking to try and improve their review activity. So just wants to understand how you've gone about that process.
So couple of things. First of all, I think I saw this question as well. It's the solution itself is not license based, is hourly based. So what it means, we can roll it out across the whole organization with the same cost, independent of how many people we have utilizing it or not. The second one in terms of cost. So essentially what we need to justify the solution across the whole of adult social care, and we're talking about 200, 300 people already utilizing it, is essentially a social care post. And this is the hours that we would use throughout the year. So the cost of the solution is relatively cheap for what the potential benefits that we can see. Now, in terms of efficiencies, what we're looking at and already seen is, rather than just, we know from an adult social care perspective, we can't continue the way we are. We have too many requests. Our demand is through the roof. It doesn't get better. So with the resources we have, what we're looking with AI specifically, in this case, Magic Notes, is to increase the efficiency that we have. So we're not linking it directly with people losing their jobs or reducing our staff's support. We're maintaining that. But what we're looking at is to say, with the existing staff, we were able to achieve this much more, and this would have cost us this much more in staff costs rather than in using AI. So that's how we're measuring it. We're doing a full 6 months report in March this year, which we can then share, which will basically starting comparing where we were to where we are now in a full rollout. So again, at some point we can share that across with the group. Yeah, share with you.
Perfect. So I'm going to take the opportunity to try and answer another question myself. So there's a question, and it's talking about AI replacing human resources. For Derby City Council, specifically for adult social care services, as Pedro's talked about, I have got waiting lists in every metric that we look at for adult social care. So people waiting for an assessment, I would like to be able to do that faster. People that need an annual review, I've got a significant waiting list. Dolls, safeguarding, we've got waiting lists absolutely everywhere. We've got something in the East Midlands called the East Midlands Dataset. We're certainly not the only local authority in the East Midlands that is in that position. I do think roles will change. Certainly the roles that we have in Derby City Council will start to change, but I cannot meet the demand that we have now. And we're trying to find a way where staff spend far more of their 37 and a half hours a week sitting with people, having those conversations, working out some of those pressures and their issues in their lives, rather than spending that time typing things up or developing care plans and risk assessments for people. So I think it would be naive to say that we won't see some reductions in staff in certain areas, but I also think it would be incredibly naive to think that we will not be able to find different roles for the colleagues that are working in adult social care now. When you look at what we've had to do over the last couple of years in terms of recruiting staff from abroad, we simply do not have the workforce that we need to meet the growing demand for adult social care. So things will change. I don't think there's any doubt about that, but I don't think we'll be in a position that people who want to work in adult social care won't be able to find a role going forward. Last question I will squeeze in, ladies and gentlemen. And again, as people have said throughout this, if you don't have your question answered now, somebody will get a response to you. Annie, I think the next question is going to come to you. It talks about cameras to alert falls, and I think you later on in your presentation you probably covered it. But the question was about how have service users reacted to the use of cameras? We use sensors in our service that allows us to monitor movements, but we have had some people withdraw their consent from being filmed. So just how have you managed some of those questions, Annie?
We're quite open and with our next of kin when they come around, and we've really explained this very clearly to everybody that it's not CCTV, which is a very difficult concept to explain, because when we see a camera, we think there should be a recording somewhere, and that the little stick figure is over a recording. And I had to explain it to myself as well, is that the little line drawing that they see are just data points of light that is reflecting into a digital camera. And that there is no recording. Neither me nor anybody can go back and view anything if no alerts have been broken. But we've also explained to them that we can't have people everywhere 24/7, and that we really like to know before a fall happens. So the reason why we installed it was not to lessen the burden on our staff. What we did is we wanted people not to fall. So we wanted that alert to enable us to get to somebody before they actually fall, and therefore give them a better quality of life. And then the end result of that is basically that our staff are more relaxed, they have more time, and we're not sitting waiting for an ambulance to come that sometimes can take 6, 7, 8, 9 hours. And also the after effect, if somebody does break a hip and they come back from hospital, our workload is tripled, because suddenly we've got to teach somebody to walk again. They get depressed, they have to receive all care in bed. So that has made a massive, massive impact. I always say to them, it is about the prevention of a fall. The whole system is just to help us to prevent a fall. And we can't access any pictures. So it is completely, I mean, I've had some very direct questions, which I won't repeat on here, but because we haven't set the bridge for certain action, it will just not do anything with it. So
Yeah.
I know it's a bit of a complex situation, but I think the designers of the system have really thought it. And that's how we've had every single person quite happily sign that it has been explained to them, and that's how we have found it. We've got 60 service users, so we've got 60 residents, and we've had it in now for about 18 months, and it's been working quite well.
That's perfect. Thank you very much. Everybody, I know we've run a little bit over. I'm going to draw it to a close today. Thank you to everybody that has spoken. Really appreciate you giving your time. Because of the chat, because of the questions you can see, I think everybody's really valued the session. So thank you very much for your time today, everybody. I hope this has been useful. Enjoy the rest of your days. Thanks all.
Thank you.